Ameriphor Ointment is a medication used to moisturize and treat dry, rough, scaly, itchy skin, as well as minor skin irritations like diaper rash and skin burns from radiation therapy. It contains emollients that soften and moisturize the skin, reducing itching and flaking. Some ingredients, such as zinc oxide and white petrolatum, are used to protect the skin from irritation, such as from wetness. Dry skin occurs when there is a loss of water in the upper layer of the skin. Emollients/moisturizers work by forming an oily layer on the top of the skin that traps water in the skin. Common emollients in Ameriphor Ointment include petrolatum, lanolin, mineral oil, and dimethicone. Additionally, humectants like glycerin, lecithin, and propylene glycol draw water into the outer layer of the skin. Ameriphor Ointment also contains ingredients that soften the top layer of skin cells, helping dead skin cells fall off, retaining more water, and leaving the skin feeling smoother and softer. It is recommended to apply a thin layer of the ointment on the affected area as needed. Make sure to use Ameriphor Ointment exactly as directed. Some products may need to be primed before use, so be sure to follow the directions on the product package. If you're unsure about anything, don't hesitate to ask your doctor or pharmacist for clarification. If the label indicates that the product should be shaken before use, be sure to do so. Apply the ointment to the affected areas of the skin as needed or as directed by your doctor. The frequency of application will depend on the product and your skin condition. For dry hands, you may need to apply the ointment every time you wash your hands, throughout the day. For diaper rash, make sure to clean the diaper area well before applying the ointment. If you're using the product to help treat radiation skin burns, check with radiation personnel to see if your specific brand can be applied before radiation therapy. Follow all the directions on the label for proper use, and only apply the ointment to the skin. Avoid sensitive areas such as your eyes, inside your mouth/nose, and the vaginal/groin area unless directed otherwise by the label or your doctor. Be sure to consult your doctor or pharmacist for more details. To get the most benefit from the ointment, use it regularly. Apply the product after bathing or showering while the skin is still damp, as most moisturizers need water to work effectively. For very dry skin, your doctor may instruct you to soak the area before using the product. However, keep in mind that long, hot, or frequent bathing/washing can worsen dry skin. If your condition persists or worsens, or if you think you may have a serious medical problem, seek medical help right away. Most emollients can be used safely and effectively with no side effects. However, burning, stinging, redness, or irritation may occur. If any of these effects last or get worse, tell your doctor or pharmacist promptly. If your doctor has prescribed Ameriphor Ointment, it means that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. Tell your doctor right away if you have any serious side effects, including unusual changes in the skin, such as turning white/soft/soggy from too much wetness, signs of skin infection. A very serious allergic reaction to this drug is rare. However, get medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, trouble breathing. This is not a complete list of possible side effects. If you notice other effects not listed above, contact your doctor or pharmacist. And remember, if you have any concerns or notice any unusual symptoms, don't hesitate to reach out to your doctor for advice. Before using Ameriphor Ointment, make sure to let your doctor or pharmacist know if you are allergic to any of the ingredients in the product, or if you have any other allergies. This product may contain inactive ingredients that can cause allergic reactions or other problems, so it's important to talk to your pharmacist for more details. If you have skin cuts, infections, or sores, it's essential to consult your doctor or pharmacist before using this product. Some ingredients in Ameriphor Ointment, such as preservatives and fragrance, may make you more sensitive to the sun. Be sure to check the label for any warnings, and ask your doctor or pharmacist if you need to take any special precautions when in the sun. Your doctor or pharmacist may recommend limiting your time in the sun, avoiding tanning booths and sun lamps, and using sunscreen and wearing protective clothing when outdoors. If you get sunburned or have skin blisters or redness, be sure to tell your doctor right away. Some products may worsen acne, so if your skin is prone to acne breakouts, look for the word non-comedogenic on the label, which means it will not clog pores. Also, some products may stain or discolor clothing, so it's important to ask your doctor or pharmacist for more details. Before having surgery, be sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, make sure to tell your doctor before using Ameriphor ointment. It is also important to consult your doctor before breastfeeding, especially if you are applying this product to the breast area, as it is unknown if this product passes into breast milk. When using Ameriphor ointment, it's important to be aware of any potential drug interactions that may affect how your medications work or increase your risk for serious side effects. Keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure that you are using Ameriphor ointment safely and effectively. If the ointment is accidentally ingested and the person experiences severe symptoms such as loss of consciousness or difficulty breathing, it is important to seek immediate medical assistance by calling emergency services or a poison control center. In the U.S., residents can contact their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center for assistance. To help prevent dry skin, it's important to use lukewarm, not hot, water when bathing, take baths or showers less often, such as every 1 to 2 days, keep baths or showers short, and use a humidifier when the air is very dry. There are various types of emollient products available, including oils, creams, lotions, or sprays. Some of these products may contain fragrance or other ingredients that some people may be sensitive to. It's essential to consult with your doctor or pharmacist to find the best product for you. If you forget to use Ameriphor ointment on your regular schedule, just apply it as soon as you remember. But do not use more than directed or use it more often to make up for the missed dose. Just stick to the recommended usage. When using Ameriphor ointment, it is important to follow the storage instructions on the package. If you have any questions about storage, be sure to ask your pharmacist. Keep all medications out of reach of children and pets. Avoid storing the foam canister near high heat or open flame, as it is under pressure. Do not puncture or burn the canister. It is important to properly dispose of this product and it is expired or no longer needed. Do not flush it down the toilet or pour it into a drain unless instructed to do so. Be sure to consult your pharmacist or local waste disposal company for proper disposal. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.